I'd like to welcome Dr. Glen Jacobowitz, the now ex-president of the American Venous Forum. We just had the meeting in Tampa, Florida for Venous 2024, and it was a great meeting. It was well attended. People really were engaged. So can you tell me about some of the highlights of the meeting in Tampa?
Sure, Dr. Ingarati. Yeah, it was really an outstanding meeting for all the reasons that you already stated. I think there were some new things this year, which were, I think, particularly exciting. I mean, some of them where we had in addition to the usual outstanding scientific sessions, we had a separate session this year on venous healthcare inequities, which was really an outstanding session. I think we had 8 different speakers in that session, which really highlighted and illustrated a problem that we have in venous care and healthcare in general in this country, but specifically venous care, really reaching proper level of awareness in this country for underserved populations, and whether that's from geographic reasons or socioeconomic reasons. There's many reasons. A lot of our speakers touched on this, and there's also many facets of venous disease, whether it's recognizing when a problem occurs, whether patients can even get access to care, even get near vascular surgeons, or even have their own primary care physicians be well versed enough in it to recognize when it's a problem, and when they can send them on to vascular specialists, and then having the capacity to find those vascular specialists. So it really was a very interesting session with a lot of engagement and a lot of back and forth and interplay. And I think it really opened up the door for next year, when I think we'll try to pursue this even more as a society. And we've already gotten feedback from some other societies that they want to look at this similarly. In addition to that, the day before the meeting started, we had a day of service, I think, which you participated in. And that we had a task force this year to look at venous healthcare inequities. That was one of the things, their initiatives that they had was with the community in Tampa and in coordination with University of South Florida and Tampa General Hospital. We had outreach to the community the day before to really hear from the experts and learn the basics about venous disease, and that we had stocking fittings and brochures and information. And I think that's really just the start. And I believe it's going to be continued next year at the meeting in Atlanta. We hope to have even a bigger impact next year and then going forward.
And quite frankly, I think other societies are looking at the success of the day of service and trying to jump on board too. I think it's really important because it's really helps lead the way forward and help leading by example. And besides talking about diversity issues, it also puts the American Venous Forum in part of the solution, to try to reach out to the community. And it was really well organized, a really important new initiative. One other thing that on the first day that seemed to go pretty well, that seems to be expanding, is the APP session.
Yeah.
Can you talk a little bit about that? Because it was really well attended. I mean, we had over 100 people in the room.
It was, and in fact, I think one of the ways that was set up, I think there was a couple aspects of that which made it so successful. One is that we were able to put it in the front part of the meeting this year, which just from a timing standpoint is helpful, because it helps the APs come into the site of the meeting in Tampa and participate fully on actually the Sunday of the meeting. And now they carried over into Monday as well. But some of them, there's our logistical issues that folks have to get back to work and such. So that certainly helped. But more importantly, it was organized by APPs. And I think that was really the key. Lorraine Letts reached out to many vascular and venous specializing APPs around the country that she knows, and really brought them together with a series of talks that were incredibly well considered, informative, and really emphasized the important role they play in venous care, because a lot of it is recognition, maintenance. A lot of venous care takes place over time, multiple visits. It can involve wound care. It can involve informing patients about what is good care with compression and the like. And it was really just fantastically organized and attended. And I think much of the credit for that goes to our APP members who helped organize that.
But also the hands-on session and the sclerotherapy sessions, I think added and really rounded out some of that program. And really glad to see that taking off. It was really a lot of fun listening to some of the talks and seeing some of the engagement of the audience members. The leadership session, the Sumner session, was also a new direction. Can you mention a little bit about that also? Because I think leadership is something that a lot of us are interested in.
Right. Yeah, that was organized by Dr. Ruth Bush, who's at the time was president-elect and is now president. And she really set up a session with a panel of nine, I think 9 people, 8 or 9 people on it, which I had the opportunity to be one, to really go through almost a question and answer session on how one came to have a leadership role, what one's training was, how much was learned on, so to speak, on the job, important tenets of being a good leader, whether that's empathy, leading, sometimes having a position of strength, but more having a lot of inclusivity with people. And we had a lot of questions from the audience about it. It was really a very interactive session. And it really, I think, gave emphasis. I think something that's going to be one of Dr. Ruth's features of her presidency. She's looking at expanding leadership training. And in fact, the AVF has already partnered with the SVS, the Society for Vascular Surgery. They have a leadership course, which meets, I think, sometimes several times a year. And this year, 2 of our board members will be attending that session, sponsored by the AVF. It's Dr. Michael Sadek and Misaki Kiguchi. And we plan to continue that year after year and expand it even further. It's really an excellent training program that looks at many aspects of leadership, which I think which can be overlooked if not specifically addressed in some of these training courses.
I also wanted to talk about the international participation in the meeting. We had a record number of abstracts submitted, and a large portion of those abstracts that were submitted and presented were from the international aspect. And the Villavicencio session also highlights those international talks.
Yeah, the AVF is truly becoming an international society. I mean, 20% of our membership are international, and I think almost 40% of our submitted abstracts this year were from outside the U.S. So they're really making a tremendous contribution, and it is from all over the world. We had representatives from North Africa, from Europe, South America, North America, and Asia, and it really was. It is becoming a truly global society. We've had webinars this past year involving our international members, which have been fantastic, and then to see them present important scientific work as well at our meeting is really fantastic. And the meeting also served as a nice way to get to meet people from around the world. It's really a coming together of many worlds, and that's the motto of the meeting, right? It's science of aims, a world without boundaries, and I think that was displayed more than ever this year.
B.K. Lal gave the Strandis lecture and really focused on research and some of the new ideas in terms of research. Can you talk a little bit about that session? Because it had some great ideas, some really forward-looking concepts.
Yes, of course. This is one of when Dr. Lal was president several years ago. This was one of his initiatives where, we have a situation. There are many components to the American Venous Forum, as you know, and we have a research council, we have a health policy committee, we have education council, and what was happening, we found a way, Dr. Lal in particular, to try to coalesce those things. So, for instance, the health policy committee will often address issues that our members are facing with, for instance, insurance coverage for standard procedures, and sometimes the carriers or CMS are looking for more data to rationalize covering certain procedures or treatments that we think are very well indicated. And instead of looking for the research, Dr. Lal said, why does the AVF sponsor the research? Or structure the research and obtain sponsorship perhaps from industry, but that it wouldn't be industry driven. It'd be driven by the AVF. And Dr. Lal at the University of Maryland has the Center for Vascular Research, which has tremendous infrastructure to set up studies. So and the AVF, of course, also has access to our members who are clinically busy and have large practices and can provide multi-center sites for such studies. In fact, he already organized one, which is called the Jury 1 trial, looking at junctional reflux in the great saphenous vein. And that was, I think, 24 months from inception to putting through a trial with about 300 subjects, and then publishing in the JVSVL. There's a second trial underway and a third one already far into development. So the structure of this is looking at problems identified by our health policy group, and then putting it together with our own research structure, and then getting sponsorship from industry. But these studies have clinical equipoise. They are put together and written by leading members of the AVF, and they're extremely forceful studies when they come out because they are from a well-respected research society such as ours. So it's a fantastic initiative, and it's expanding.
The last day had the late-breaking trials, and those are really amazing. You had so many different trials that were being presented, between CEATTRACT to the VenoValve trial, the VIVID trial, the SAVE trial, all encompassing all different aspects, ranging from lymphedema, ranging from deep venous insufficiency, deep venous disease, superficial disease with cyanoacrylate. Can you mention a little bit about that? I mean, that was really amazing hearing so many new trials that are going on, updates on trials that are up and coming.
Yeah, these are multi-center trials on some of the latest devices. For instance, as you mentioned, some are thrombectomy, some are non-pneumatic compression devices. Really, all aspects of venous care, from interventional to less interventional, and they're really. It was exactly that. It was an update on work that's being in mid process or wrapping up, and it was also an explanation of trials that are just getting underway and others that are about to get underway. So it was really an all-encompassing session, and it was so timely and so informative. I think one of the greatest proofs that you can see that it was such a good session was it was one of the last sessions of the meeting, and it was extremely well intended. I think that the room was full on the mid-Wednesday morning of a meeting that was going to wrap up around midday on Wednesday. So I think a lot of attendees were very interested in getting information on these trials, and indeed that exactly what turned out to be the case, and it was an outstanding session.
All in all, the meeting was really excellent. Attendance was excellent. Engagement was excellent. The quality of the science that was presented was amazing. I really enjoyed your presidential speech also. It was very, very enlightening. So thank you very much, and looking forward to seeing everybody at Venous 2025 in Atlanta.
Likewise, and thank you for your contributions to the meeting too. Outstanding as always.
Thank you.